So as a cancer patient, I am much more aware of my mortality. But I think that I not only will live longer because of the Duke Integrative Medicine program, I think I'll have a much higher quality of life because I want to be able to dance.
The way that we approach integrative medicine here at Duke, our definition, if you will, is still to be adherent to evidence as best we can, but to balance that with patient-centeredness. So what's important to the patient? What does the patient believe in? If it's not harmful and there is some evidence for it, we'll want to support that, but not to the exclusion of regular medicine. So another key principle of integrative medicine, from my perspective, is it's not alternative medicine. It is the very, very best of medicine, period. Whether it be Western-based biomedicine with pharmaceuticals, shots and surgery, or be it other things like nutraceuticals or adjunctive things like yoga, the use of the mind-body approach, psychotherapy, biofeedback, acupuncture. We try to take the best from all worlds if it is in accordance with what the patient, what makes sense to the patient.
I'd always considered to be lucky until 10 years ago when I found out that I had cancer. And as it turned out, my father passed away in 2008 from complications from bladder cancer. And during a routine physical, my doctor was a little bit concerned with something that she saw, and with my father's history, referred me to a urologist who ordered a series of tests, including a CT scan. And I remember being so nervous taking the CT scan that the technician, I think, just took pity on me and said, "I'm not supposed to tell you this, but I do these all the time and I don't see any bladder cancer with you." So I just went about my life and thought that it was going to be going really well. And I was surprised when the doctor called me in 2 weeks and said, "I'd like for you to come in for us to discuss your test." And he said, "The good news is you don't have bladder cancer. The bad news is the radiologist thinks you might have lymphoma." Now at this point, I was in a panic because my mother had had 2 forms of non-Hodgkin's lymphoma. So for me to hear cancer, I was devastated. I remember going to my car, sobbing, and calling my husband to come and get me.
Integrative medicine. Most people have probably never heard the name. And those who have, they think that it is the same as alternative medicine, and that integrative medicine rejects conventional medicine, surgery, and pharmaceuticals. Nothing could be more wrong. To understand why Deborah Tippett recovered so well from cancer, we need to look at the philosophy behind Duke Integrative Medicine.
If you think about it, medicine in its purest sense is really about a healing process. It's not about pharmaceuticals. Pharmaceuticals are a method or an intervention by which we help or hope to help cure. But the soul of medicine is about healing the whole person. So that's why we have it right when you walk in the door, that's our message to you. Similar to our Bill of Rights. So the Bill of Rights for integrative medicine or integrative health and medicine is sort of a expansion of the Bill of Rights that we use in healthcare. And it's really our message that we believe in you, we see you as a whole person. We understand when you walk through the door There's a whole dynamic of things that have occurred for you prior to being here. So the Bill of Rights is honoring all of that, and we do that in a partnership with you.
Duke Integrative Medicine has a strong focus on research. All treatments that are offered have their roots in science and evidence-based research. Treatments like yoga, mindfulness, nutritional counseling, and acupuncture have been proven effective.
Where we are today is at a very exciting point because, as more and more research is being conducted in the space of yoga, acupuncture, mindfulness, MBSR, what we're seeing is that these modalities are effective. They're effective for addressing certain needs that conventional medicine, conventional therapies cannot address. And so what we're seeing is just a huge interest because now we're having the scientific evidence, the evidence base to then change clinical practice.
Deborah Tippett's cancer journey started with slow-growing non-Hodgkin's lymphoma that is maintained through chemotherapy and watchful waiting. Her second cancer was ovarian cancer, which she is surviving.
Dancing time.
Before we reveal Deborah's dancing skills, there was a time after her cancer treatment that she couldn't dance and feared that she would never be able to dance again.
By the end, I had neuropathy. And neuropathy, for me, it was in my hands and in my feet. And my first response when I talked to the doctor about this, and she told me that 20% of cancer patients with that treatment, it was permanent. I thought, I can't dance with a neuropathy. And then I thought, I can't walk either. And neuropathy is terrible. I would go into my walk-in closet at night and not turn the light on, and it would be dark and I would just fall. My clothes would hold me up. But it was terrible to lose your balance. And then your fingers, and there was also pain associated. I felt helpless. I felt vulnerable for the first time. Now, you would think I would feel vulnerable before now. But I felt scared and vulnerable this time.
The neuropathy made Deborah decide to take a deeper look at her treatment possibilities.
So for me, the neuropathy was more of the tipping point. I thought this can be a permanent condition. So I asked the chemo nurse one day, I said, what do other patients do for neuropathy? And she said, well, I'll ask. So she went around to all of the nurses in that big facility and came back and said, for hands, doing some kind of hand work like knitting, and for feet, acupuncture.
At first meeting, I thought there were a number of specific kind of evidence-based things we could do to help her. Because the evidence is fairly good for acupuncture helping with the pain of peripheral neuropathy. Either if that peripheral neuropathy is caused by diabetes or after chemotherapy drugs, which was her case. Dent it a little bit, and then there is so that goes right through the skin. There are multiple sites in the brain where research has shown that acupuncture does something. It makes a difference. And one simple way I may describe this is that I think acupuncture can reprogram what has happened in the brain that keeps the pain loop going. And this can have to do with descending inhibitory pain impulses, to use a big phrase. And it can also trigger the release of endorphins and enkephalins. You may have heard of this before, what creates runner's high, for instance.
The National Cancer Institute has just published a study that shows how acupuncture works for cancer patients.
It talks about how acupuncture can cancer patients, both with regard to pain control, peripheral neuropathy, and other things like nausea and vomiting, and help with subtler things that cancer patients sometimes suffer, such as difficulty with sleeping and anxiety.
Samuel Moon has practiced acupuncture for 30 years. He offered Deborah 6 sessions of acupuncture.
Now, in Deborah's situation, because she had peripheral neuropathy, and because she didn't have any reasons not to, like she didn't have a heart pacemaker or a seizure disorder, I was also able to use what's called Electro Acupuncture, which is where alligator clips are hooked to the back of needles, and a small 9-volt battery powered unit is used to put electricity into the body. And so these sessions last maybe 20-25 minutes. I move the needles around, we'll change the electricity a little bit, and after half an hour, things are unhooked, the needles are taken out, and she rests for a few minutes and home she goes.
The results were remarkable.
I've been through a lot of treatments, but acupuncture was not painful. I had 6 acupuncture treatments, and at the end of that, the feeling came back. Not only could I dance and walk, and I had my balance back, and I could do all of that, but I didn't have the pain, because there's pain and a sharp shooting pain with neuropathy.
The million-dollar question is, how does this actually work? There are probably somewhere between 12 and 18 mechanisms that have been investigated and I think demonstrated from a Western science perspective as to how acupuncture might work. And these range from things that can happen locally, such as the release of certain chemicals right where the needles are, to alteration of nerve impulses close to where the needles are, to going on up the spine, things that happen in the spinal cord before the needle impulse even makes it to the brain. Famously, Melzack and Weil, Canadians, promoted the idea of the gate theory, the spinal cord gate theory, that says before impulses can make it to the brain, those impulses have to go through a gate in the spinal cord. And only one thing can go through at a time. So impulses that come from C fibers, tiny fibers that carry pain, can be blocked by impulses that come through A delta fibers, which are bigger and respond to what are called mechanical receptors. So electricity, for instance. So one small part of this may happen by blocking impulses at the spinal cord, and that could break what we call the loop of pain. Some people call it engram pain, or the idea that once you've had pain for a while, a loop happens in the nervous system and it just keeps going unless you interrupt it. The body, the mind, the spirit want to heal. And if we think about it, this happens many, many times every minute. There's so many things in our body that self-correct. And so that is at the heart of acupuncture. Acupuncture doesn't necessarily fix so much as it redirects and helps to stimulate the body's own self-healing mechanisms.
The primary goal of oncologists is keeping their patients alive. Integrative medicine looks holistically at the entire person, the mind, the body, the spirit. And every time I meet with my doctors, they ask me what I'm doing about every area of my life. The wheel of health is not just theory, it is practice.
We could just take a moment. Sure. I need one.
Take a good look at this. These practitioners represent Deborah's Integrative Medicine team. Together with Samuel Moon, they work together to make Deborah well and strong again. Deborah's team consists of a medical doctor, nutritionist, massage therapist, acupuncturist, and writing clinician. And keep in mind that Deborah has also received chemotherapy and surgery during her cancer treatment. So you can say Deborah has taken the best of medicine in all aspects. The practitioners each know what kind of treatment the other practitioners give to Deborah. And during their meeting, they discuss the treatments and how Deborah is doing. The patient always starts with a primary care visit with a medical doctor.
Hi, Deborah. How are you doing? Good to see you. So the initial visit is an hour. So that's and it's amazing how quickly that goes. Actually, you think it's a big period of time, but it goes very quickly. And then follow-ups are 30 minutes.
After 17 busy years in primary care, Susan Blackford changed to integrative medicine. As a medical doctor, she has met some resistance towards integrative medicine from colleagues who do not believe in yoga and acupuncture.
How can you not believe in something that works? I guess it's just simply that. And maybe that's not a satisfying answer, but for some people, but I see what it does. I see the difference. Personally, I've seen so much growth in my patients and a feeling of calmness, a feeling of wellness. And it's hard to quantify, but I can just say that the feedback I get from my patients is the proof that I need.
Yes. Very much.
This last treatment was much tougher. It was a more aggressive chemotherapy. My hair came out within 3 weeks. My blood counts went very low. My red blood counts went so low I had to have a transfusion.
When a person gets cancer, there's a lot of focus on the actual cancer, which is of course the main focus at the start. Getting the surgery, the chemotherapy, getting rid of the cancer. But at the same time, a lot of other things are happening with the cancer patient.
So Deborah's an amazing lady. And she had already been through a whole lot by the time that I saw her. She had been through basically 2 cancer diagnoses. Often in the world of cancer, everything gets focused in on the cancer and other things get neglected. My first desire was, first of all, to hear her story in its entirety and to honor everything she had been through. And then to kind of look around and say, okay, what else is going on? Let's just set aside the cancer for now, and let's look at Deborah.
Most cancer patients get many different pharmaceuticals that help them during recovery. And that is needed, and that medicine serves its purpose, but only for a while. The problem is that many patients remain on the medications for too long.
She had 2 products. One was a proton pump inhibitor, and then also an H2 blocker. Now, her GERD symptoms were a result of her treatment for cancer. And this had been about 2 years or so that she had been on those medications. And one of the concerns was that long-term use of those medications can contribute to low bone density. And she was already had osteopenia. So we really didn't want her on those medications long-term. And so the physicians here requested that she work with a dietitian to get off of those medications.
In Deborah's situation, we tested her B12 level, her B6 level, and her folate level. Now, particularly, we're concerned about B6, which is also called pyridoxine, because it's been pretty clearly shown that people that take high levels of vitamin B6 are subject to a risk of getting polyneuropathy just because of taking that B6. So in this situation, she already had a reason to have polyneuropathy, which was her chemotherapy. So the last thing we wanted is to add on another substance that might put her at risk of polyneuropathy. So we checked her levels and then adjusted her dose to right size it for her condition.
At Duke Integrative Medicine, the nutrition team addresses factors contributing to symptoms or disease conditions, such as genetics, lifestyle, or environmental toxins.
The Academy of Nutrition and Dietetics has provided us a really great structure for working with clients to resolve their nutritional concerns. And that involves a nutrition care process, which starts with an assessment, and we will look at not only what's happening to them physically, so we'll look at their nails, their hair, their skin, and do a nutrition-focused physical exam. And we will also use symptom questionnaires and do a diet recall. And then we're going to look at a diagnosis and figure out what exactly is the primary cause of their symptoms or their disease. And then we will come up with an intervention, and we will then monitor that and follow up and make sure that we're reaching the targets that we've set.
Deborah Tippett responded very well to her treatments and changes to her diet.
She, I think, was exceptional in her response. And I have had other clients where it's taking longer, and we've had to use a variety of different strategies. But in her case, it really was pretty quickly.
Jill is just like Dr. Moon. She will come up with more things to improve my health. She emails me all the time and says, I think you need to take this Writing to Heal class.
Well, actually, it's pretty simple to talk about what a writing clinician is. It's a person who supports the work of a clinic by facilitating others who are patients at the clinic to write about their experience, especially focusing on their feelings and about how it has shaped who they think they are. And not only their relationship to themselves, but also their relationship to others. Because as we know, when you have a chronic, serious illness, sometimes you're really overcome with emotions, and the people around you are affected as well.
I think that with cancer, with both treatments, I was trying so hard to just get through them, to stay positive, to have hope for a good outcome, that I didn't really acknowledge my feelings. In fact, the workshop for me helped me acknowledge the feelings at the moments, because I really thought about, well, how did I feel? Disappointment, just shock.
So Transform Your Health Right to Heal is a prompt-driven exercise. It's not journaling. It is a progression of prompts. So for instance, the first prompt is write about your most traumatic experience in your entire life, write about how it's affected you and your relationships with others, how it affected how you think about yourself, how you feel about yourself, how you feel about others.
I don't like to see myself as a victim. I don't like it when people feel sorry for me or look at me with pity. And I hadn't really thought about it as being a trauma, but it was. And it wasn't just a trauma for me, but it was also a trauma for my husband. Sometimes we would go into waiting rooms and people would assume that he was the patient and not me.
She hadn't really been able to access her emotions. And as she described her experience with the expressive writing prompts, she said, I'm so busy going from one thing to another and focusing on what's next that I didn't really stop to take inventory of how I was feeling. I mean, she said, I asked her, what was your primary feeling about it? And she said, well, I did feel some anger. I did feel anger about this, but I also felt sad in how it was affecting my husband. because he seemed to be, she said he seemed to be really suffering more than she was on the outside, at least. So when I think about why it works, why some of this works, I think about some of the work that Rick Hansen has done about neuroplasticity, about the ability to change the brain and the way the change operates. Rick suggests in the book Buddha's Brain that when we are triggered, the amygdala is sounding the alarm so loudly that the hippocampus can't act rationally, can't make rational choices, can't process information the way you might normally do. So while we try to access things that would relieve our stress, we can't, because the amygdala is just telling us that we need to get out of here or we're going to be lunch. And so it's very primitive. Our response to emotionally overwhelming circumstances triggers a very primitive response. But when we access language, we reframe that experience. And we take that thing that's abstract and we make it concrete. And when it's concrete and out of us, when we make the implicit explicit, it's out here and we can more objectively and in our own language satisfy our needs. So we don't have to flee or fight, but we can stay.
You might think, does this really work? The answer to that you can find in a study made with Dr. Glass at Duke Integrative Medicine.
We lowered depression by 32.6%. I expected that it was going to be beneficial. I didn't expect that it was going to be that beneficial. That's better than an antidepressant.
The qualitative study, Expressive Writing for Trauma, shows how writing to heal works. It also measured rumination, resilience, and stress.
So our study also showed that we were able to decrease perceived stress by 29.8%, which I will take that anytime. So that's an opportunity for people to turn around, to stop cursing and start praising some part of themselves that has given them a challenge, that they have found challenging. And sometimes they write about their cancer. Sometimes they write about other areas of the body that's given them challenges.
These feet are long and narrow. They need places to go and spaces to dance. They don't like to be still. These are free feet. They don't like to be squeezed. And these feet have never been bound. They twirl and spin. They set me free. These feet are beautiful. These feet are mine. I have known them to climb a mountain, dance a tango, and carry me home.
One of the important factors about when an individual experiences trauma is resilience. So resilience is really the ability to kind of combat that challenge of trauma and combat stress in a way that you are able to come out the other side doing well. And so in that particular study, we saw a significant improvement in patients that participated in expressive writing for their resilience. And so, that was a really interesting study because, again, it goes back to this fundamental nature of just writing, just, handwriting. We typically don't do it anymore. We're more or less on the computers now than we have been. And so just that nature of writing, getting your thoughts down, being very clear and intentful about what you're writing, can actually have a profound impact and lasting impact. So to improve resilience and your ability to handle stress is a big deal, especially for those that have already experienced something like trauma.
When Ms. Deborah first came in for a massage session, She was just finishing up her cancer treatments. She was recovering from her cancer treatments. And I can tell she was tensed from anxiety. Seeing the anxiety on her face and her body language, that's when I let her know, I've been there, I've done that. I can relate to what you're feeling, and it's going to be okay. I'm a breast cancer survivor, and those feelings of anger and why me, and just the anxiety of going through everything, I can relate to. I've been there. So I just wanted to let her know, this massage session is not about poking you, and it's about relaxing. It's all about you. So that made her relax. Yeah.
How wonderful.
I can tell she needed a gentle touch and just a relaxing environment. And I will do anything to give that to her. I thought that a Swedish relaxing massage was best for her, with long strokes, long gentle strokes, to work with the central nervous system, to relax her body and her mind. And it definitely worked. Now I can see a complete difference with Miss Deborah. She has a pep in her step. She is now dancing again. She's traveling all the time. And she's just excited about life and refused to let any cancer get her down. I want my clients to feel comfortable with me. If they feel like crying, go ahead and cry, it's okay. Whatever they're feeling at that particular time, I just want to let them know, I'm here for you.
I don't want to be a cancer survivor. I want to be a cancer thriver. I want to live a good life. I want to use the best quality of life I can.
So, exercise oncology is really just the study of exercise across the spectrum of cancer. So that's actually in the preventative setting before patients get cancer, so during cancer, or even in the survivorship area. And so, what we see overall is that exercise is certainly effective both in the preventative setting and in the survivorship setting. And in looking at somebody like Ms. Tippett's case, where she's doing very well, she's dancing through her cancer survivorship. It's great to look at people that are doing really well and also people that may not be doing well, and to look at those differences and figure out what are those factors that are allowing people to do much better in their chronic disease states or in their survivorship states. Like, what are those factors and how can we understand them better to then support the people that may not be doing as well?
That's really a core component of integrative health and medicine, right? That's why we have our Bill of Rights. It is about a person's dignity. It's not about being a patient. We're all people. We become patients because we have a healthcare need. So the idea of spirituality, I think, has been probably one of the greatest challenges within integrative health and medicine. And I think in part because people initially think about religion when they think about spirituality. And spirituality is really that connection with yourself and the environment that surrounds you. And for some, that might mean a connection with something greater than yourself. We use the idea of purpose and fulfillment, the sense of purpose and meaning in your life.
otherwise. I got out of bed, looked at the forest, and had a cup of coffee. It might have been otherwise. I ate toast and honey, and oatmeal and banana and nuts. It might have been otherwise. I walked through my neighborhood, and all morning I read and saw friends. At noon, I ate lunch with my husband and maybe take a nap. And it might have been otherwise. We ate dinner on the deck and danced to beach music. It might have been otherwise. I slept in a 4-poster bed in a room filled with family treasures and planned another day just like this day. But one day I know it will be otherwise.
They twinkle when you smile. It felt this warm and wild. That northern star shines straight from your heart.
You deserve to be treated more than at the cellular level. You deserve to be treated holistically as a whole person. And if you don't have cancer, you are truly fortunate. But I promise you, you will have someone you love who has cancer at some time in your life. And for the 50% of women and a 3% of men out there who already have cancer with me, or you'll have it sometime in your life, I will say, do more than just getting through the treatments. Treat yourself well. Figure out a plan that looks at your whole body.